Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? I was at a lecture a couple of years ago, performed by two doctors who'd undergone treatment for breast cancer and written a book about it together. I remember her talking about her diagnosis. She was a breast cancer surgeon herself. You couldn't make it up. She walked into the room, saw her own scans with the doctor, and her heart dropped. She barely heard a word he said because she couldn't stop the flood of information she was getting. Looking at the scan, she knew if she'd need surgery, chemo, radiotherapy, how long it would be, what her estimated survival was. I don't think they discussed it like a group project, but I suppose she couldn't stop herself from listening to her own internal monologue since it was her own field. I remember her saying she'd found it, in hindsight, an incredible learning opportunity regarding how to interact with patients, and that she thought about it a lot. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine type stuff, I don't bother going in unless I need something that I can't easily get for myself, e.g. labs or images. For specialty stuff I wasn't trained in, I go in and try to give them the best history I can, but let them do their own thing. Internet high five from an oncology patient. Thanks for doing what you do. Chiming in to agree with the other poster. My son had cancer and his doctors were amazing and kind. You really look to your oncologists for answers, and sometimes hope. So, thank you for what you do. Doctor here, neurologist. I'm not good at going to the doctor. I don't go often, but when I do I usually just STFU. Especially if it's a field of medicine I have no idea about, like say, DUM. That being said, the doctor usually knows I'm a physician as well, and so the language terms to be more technical. I also find that we practice less offensively with each other, since we can be more open. We could do ABC tests, but honestly what you probably have is X, so take this, and if it doesn't get better then we can do ABC. Real question is, do you understand the prescription the other doctor writes? We don't really write prescriptions much anymore. Usually it's computer generated. My mom's a GP, and she usually just self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor, just calls them to ask about stuff. Her contacts are filled with all kinds of doctors. It's like a secret underground community for stuff like getting ultrasounds etc. Then yes, they do discuss stuff like it's a group project. I hope you get some doctors in here to give personal answers. Paul Kalanithi did address this a bit in his book, When Breath Becomes Air. At first in his cancer treatment he was very involved in the decision making, and the way he described the conversation with his oncologist was more like a collaboration. Later, she reminded him that he didn't have to participate in the decision making, and that he could just let her be the doctor and focus on himself. He ended up taking her up on this offer. So even between the same patient and doctor, the relationship varied. One of the best books I've ever read! Exclamation mark. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part they are pretty good patients, because they can give a good description of their symptoms in a way that's useful to me. They usually ask good questions, and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk where I simplify medical terms for lay people. Sometimes it's challenging if their area of expertise is totally unrelated to the issue at hand and they don't recognize their limited understanding. The worst patients are those who have just a little medical knowledge and think they know everything. Some version of, my aunt is a nurse, and she said I need a whole body MRI for this runny nose. Apostrophe. As far as self-diagnosing, I usually deal with my own minor medical issues. If I noticed signs of something more serious, I would go to someone else. As a veterinarian, many of my worst clients are nurses and doctors. Lots of questionable home diagnoses and treatments. Yeah, people and animals are pretty close, but we are not the same and medicines don't work 100% the same. I agree about having difficulty dialing back the patient talk though. These are folks that can understand medical terms. And I don't want to be demeaning, but I've got my dumb bed down spiel about things and it just flows out. To be fair, I recognize that I'm probably annoying to my doctor too. Although when I went in for surgery last year I had a great time chatting with the anesthesia nurses about protocols until they drugged me. I'm also a vet, and I usually don't even tell my doctors what I do. I once let an endocrinologist go through a whole explanation of what hypothyroidism is to me because I didn't want him to accidentally skip over something that's different between humans and cats. Turns out it's pretty much the same. And in the end I don't have it. Doctor here, family medicine. I self-diagnose most things. But for my 1-year-old daughter I decided a while ago that I don't want to do that for her. So her pediatrician doesn't know I'm a doctor. I never told her. I want her to treat me like any other parent and explain everything to me like I'm 5 years old. I'm afraid of being too nonchalant with my daughter's health, that I'll miss something, or the doctor assuming I know more than I really do. It's actually a strategy I've adopted since on myself. If I go to a doctor, say a gynecologist for a routine checkup, I sometimes just don't say what I do, so I can legitimately ask dumb questions about things that I should really know, or so that the other doctor won't leave out important info that they assume I know for fear of insulting me. On the other hand, my regular doctors do know, such as the gynecologist who saw me through my pregnancies. And that enables more complex and nuanced discussions about health decisions, as in debating questions and giving me options that he wouldn't necessarily do with itty patients. BC he can be sure I understand the medical pros and cons well once I'm given a basic explanation. I wish I could do that with my kids. I'm not a doctor at all. I'm a sonographer and do ultrasounds. I work at the same hospital that my children's pediatricians group works. When my son was born in April he ended up in the NICU. The fact that I knew everyone up there from scanning in the department was comforting. I know they are good people and practice well. At one point the NICU doctor said, well, you know how that is, and I had to tell her no. I have no clue how that is. I don't do diddly squat with lungs. I know the basic anatomy and that is it. Which is true. Lungs have air, so ultrasound doesn't go anywhere near lungs. She told me I was going to get the normal script from then on out, so don't feel insulted if she told me things I already knew. Nope. Explain it to me like it's my first day ever setting foot in a hospital. Please. That way no one assumes someone picked up what was left down. If anyone wanted to better understand what a high context and a low context culture is and how they impact communication, these are excellent examples. Doctor here. In general, we are not good about going to the doctor. For me it's physicals about half as often as recommended, and that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it is like a group project. We usually hash things out together, but ultimately I'm going to defer to someone with more expertise than me in that area, who can make an objective decision. When I go to the doctors it's also like a group project. I'll let everyone else do the work and reap the benefits. LMAO so accurate. I was sat in a consultation between two doctors with one needing an ultrasound. They knew each other through work already, so it was very friendly and casual between the both of them. The patient's doctor trying to figure out what was going on the ultrasound screen, and the doctor was teaching him the bits he didn't know. My dad's a doctor, and he said he'd stay up till 2 or 3 AM discussing med school topics with his roommate. Sorta for fun. And also for the obvious benefit. I can't even imagine the amount of nerd power being generated in that room. Doctor here. It is a bit dependent on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist I certainly wouldn't be chipping in. For more generic conditions I have previously offered my thoughts to my doctor about what it could be. Ultimately I still go to the doctor as they can prescribe drugs / order tests for me. That would be difficult / questionable for me to do myself. Your answer seems to be the most genuine and reasonable answer yet. Ty. His name isn't Ty, it's Drive. Big Mac. Both my parents are doctors, and they see each other as their doctors. For their situation, they don't make appointments for anything. So if I or they get like the flu they just write a prescription. If they need specialists, they usually tell them they are doctors and they get better treatment like skipping lines or whatever. Or they know each other already so it's chill. I'm sorry this kinda sounds spoiled, but it's my experience. I always go to someone who don't know me, and I won't say that I'm a doctor as well. On the other hand, my so is a doctor too. And whenever we feel something we do discuss it like a group project in which he always refused any treatment until his symptoms got to the very worst. First of all, love the username. For some reason your comment reminded me of something that happened with my ex-husband. Has critical care / anesthesia. My ex, an accomplished drinker, went in for a routine checkup with a doc he didn't know. Doc asked all the standard questions, including how many drinks do you have a day. My ex made up some lowish number that he thought would be appropriate. The doctor said, "Oh, that's a lot. You should have lied." My ex said, "I did lie. Did I not shoot low enough?" LMAO. That's great. I try to act like any other patient. Medical people can very much sabotage their own care by taking shortcuts or perhaps declining to approach their own problems the way other patients do. It's a mistake. I have seen harm done that way. I don't come in for trivial things like self-limiting infections or things that are harmless, because I know that they are. But I do go see my regular doctor for problems that really bother me, or for routine exams like anyone else. It can be weirdly stressful to be the doctor or the patient in this kind of interaction. I've learned to not let it bother me when I'm the doctor seeing other doctors. It can be harmful to the doctor as a patient if you let that kind of interaction get to you. I try not to generate stress for other doctors who see me and know what I am. That could be detrimental to me. My grandpa was a cardiologist, and he's the worst at knowing when to go to the doctor. As he got older he would get cardiac arrhythmia, but keep saying that everything is fine and he doesn't need to get checked. I'm guessing everything was not fine. It's not so bad. Besides, he's 91 now. Doing something about it would be too much stress for what it is and wouldn't be worth it at this point. Better ride this one out. As a doctor, when I go to my PCP all decisions are made in tandem, and I do have more input on my treatment plan than a layperson. But I second what others have said. When I'm seeing another physician like a specialist I'm more capable at making informed decisions than a layperson, but will always defer to their experience and knowledge. 2 examples. 1. Had a PCP that said jokingly to a medical student in front of me, "How the hell could he even sue me?" As a doctor promptly found a new PCP. It's okay to not like a doctor. Even doctors dislike other doctors. 2. I'm a doctor with literally tens of thousands of hours of experience and knowledge saving people's lives, and even I know that I don't know 0.1% of what Fauci knows. Wear your goddamn mask, it's not a debate doctors are having. Just morons. Forensic pathologist here. I keep my mouth shut and let my doctor. I have a pulse, so I'm not the expert here. Doctors that self-doctor are scary and arrogant. I am HO. And when you don't have a pulse, they can discuss it with you all they want, and you won't care either. Will you? Greatest doctor call of all time. First, paramedic here. Not doctor. Call for chest pain. Side of the road. Guy pulled over to call 911. Not local, just passing through. While my basic is slapping. Leads on I'm getting some history. Guy is obviously well educated. Knows his stuff. And just speaks the lingo. I run a 12 lead. It's bad. Not end of days. Just hey, let's get the cath lab wound up and drive really fast. It's also a little odd. So I decide to flip it. 15 lead. Flip it again, do a right side. Whole time we are making tracks to the Guy asks about nitro, and I start explaining that certain types of heart attacks can be made much worse with nitro. He asks to see his strips. Humor him. Hand them over while I'm calling in my report. He thanks me. Say I'm right, it's anterior etc. And has going to needs his bypass etc. Freaking cardiologist. Coolest. Most laid back part ever. Having a freaking heart attack. And starts explaining to me about the surgical process he's about to be under. Neurologist here. I always assume a rare, worst case scenario when it comes to me or my loved ones. I always rely on doctors. Healthcare has become so specialized that it's not possible to know everything outside your speciality. It's always good to ask for help. Having said that, I'm a terrible patient. It's not rare for a doctor to self-diagnose and just go to a clinic to get someone to confirm it so they can get prescriptions, but you're not supposed to be diagnosing yourself and should be acting like any other patient. Describe symptoms and let them decide what you have for themselves. I try not to tell them that I'm a doctor. I'm a very anxious patient. I just know too much about the terrible diagnosis, which can change your life in an instant, and have anxiety around my mortality. It's easier if they don't treat me like a knowledgeable professional, but like the irrationally fearful person that I am. I know I'm not the intended target, but I'm an RN case manager for a primary care clinic, and going as a patient into my primary provider's office is funny, but generally, for me, I've found I lose all sense of medical knowledge when I hold my kids other patients, maybe out of panic. So I have called the Triage Advice RN for my kids, a job I do on a daily basis, and if my provider asks if I have any diagnostic requests for my own medical care, I always tell her you're the doctor. I trust your judgment on how much or how little she wants to order. I had a lovely dear friend in Poland who was a vet. One day his upstairs neighbor came screaming running down the hall looking for him. It turned out his little girl had stuck a safety pin into the roof of her mouth. And even though he was a pediatrician and one of the best known and loved in Warsaw, he couldn't reach in his daughter's mouth and pull it out. He had to get my friend the vet to do it. Yeah, animal science and human science are similar, but not the same. Lol. I also hate how people say vets aren't real doctors. They can diagnose, fix and cure just like a human doctor does. People really take vets for granted, and it pisses me off. He who acts as his own doctor has a fool for a patient. Osler. I still treat myself for the majority of illness though TBHI, knock on wood, don't really have any conditions. I'm also an ear doctor, so that may be different for other specialities. When I've had injuries, ACL, I think it just helps the other doctor to communicate in our language, which usually makes things quicker. If my family is sick, I usually assist in translating, but try to not step on the other doctor's toes unless I think something is awry. I had a skin condition and saw a dermatologist. I spoke to her in shorthand. She did the same. She started explaining a biopsy. I stopped her and said, "Do it." 30-minute appointment took about 5 minutes. Doctor here. 90% of the time I don't even tell them I'm doctor. They are experts in their own field, so I always respect their knowledge base and listen, just like I'm a regular person. Unless it's my wife who is a doctor also, then I definition don't listen. Ever. That's what she said. Hey PSSST. Please subscribe and like.